Hello, my name is Richard Duncan. I'm an orthopedic spine surgeon here at Watauga Orthopedics in Johnson City, Tennessee. I wanted to share with you a few minutes about lumbar facet-based pain and the lumbar facet medial branch blocks that myself and my partner Dr. Mark McQuain perform at Mountain Empire Surgery Center. First off, a little bit about back pain and chronic low back pain. Chronic low back pain, meaning back pain that's been going on for more than 3 months, typically is not muscular in origin. There's two common places that back pain can come from. One is disc degeneration. Disc degeneration happens in all of us once we get past about 18 years of age. The disc wear out. It's like having a bad shock absorber in the car. You get some abnormal motion and that can cause back pain. There's a video here on this website that talks in detail about disc degeneration, and I encourage you to take a look at that. One other common area that back pain can come from is from the facet joints. It's not uncommon to see people that have pain coming from disc degeneration and from the facet joints. And in many instances, it's difficult to tell whether a person's pain is coming more from one than the other. Therefore, we do have a diagnostic test that I was going to go over with you that will help us differentiate that. And in people with pain that comes from the facet joints, it may allow us to perform a procedure that will significantly decrease back pain in the long term. First, let's talk a little bit about anatomy. When one looks at this model of the low back from the side, this would be the front, this would be the back. These are the bones, and then the discs are in between there. We've already talked about disc degeneration and the fact that abnormal motion there in the disc can cause back pain. But in the posterior aspect of the spine, there are facet joints. These facet joints are like a knuckle joint. They have joint fluid, they have cartilage, they have ligaments around the joints, and then they have some tiny nerves that go to the joints. These tiny nerves come off of the larger spinal nerves, but as you can see, they're a good deal away from the spinal nerves. When these facet joints become arthritic, it can in many instances cause pain in the low back that is associated with these arthritic joints. Typically this type of pain is on one side of the back or the other, and it can also radiate down into the buttock and sometimes into the thigh area. So by going in and blocking the tiny nerves to the facet joints, in many instances we can improve the pain. You can see here, looking from the side, the tiny nerves to the facet joints come off at the facet joint and just up above. So to block this particular facet joint, one would need to put a small amount of local anesthetic here and then here. We do this under fluoroscopy over at Mountain Empire Surgery Center, and I will show you a video in a few moments showing that procedure and discussing that in more detail. Here we are in the operating room. We've prepped out the back and we've numbed up the skin, and under fluoroscopy, under image, I'm placing a tiny needle there in the back. We check it in both views to make sure it's in good position. We're placing it where I showed you on the model there, right where the tiny nerve is. We're looking at it under x-ray. Once we make sure that it's in good position, then we'll inject a small amount of contrast material to be sure we're in the proper position, and then we inject the local anesthetic after that. There's minimal pain with this. The skin and the muscle has been numbed up, so there's minimal discomfort with this. Usually a small amount of pressure there just as we inject the medicine, as you see here now. This is an x-ray image where we injected the material there, and this is what it looks like on the fluoroscopy unit. Medial branch block at 1 or 2 levels typically takes around 5 to 10 minutes. Again, it's done as an outpatient at the surgery center. We typically don't give any additional medication or sedatives. It's a diagnostic test. So what we're doing is we're numbing up the skin, injecting a small amount of local anesthetic right down around the tiny nerves that go to the joints. And then we ask the patient for the next 4 hours to go out and do the things that typically cause back pain, and keep a log every hour of how their back pain feels following the injection for the first 4 hours. Whether the pain has gone completely, 50%, 80%, 0%. Then we typically will see the patient back in a few weeks. We'll go over the pain log, and if we got a successful result, in other words, if after the injection back pain is significantly reduced, then that's considered a positive response. If we get a positive response, then we have the option to go back and re-inject it with a different type of medicine, but it's basically a similar injection. And if we get 2 positive responses each time the back pain was significantly diminished, then we have the option of doing what's called a denervation. The denervation procedure is also done as an outpatient. It takes a little bit longer. To do a 1 or a 2 level denervation takes about 20 to 25 minutes. Again, it's done with a patient awake under local. We do give a little bit of sedation during the procedure. During that procedure, we numb up the skin and we place a special needle down in the same exact spot as we've done the blocks before. We do this under fluoroscopy. We test to make sure the needle is in the appropriate and safe position, not only visually, but with our machine. Once we've tested, we make sure it's in good position. We numb that area up with a bit of local anesthetic, and then we're able to heat the tip of that needle up to 80 degrees Celsius for 90 seconds. This effectively burns the little tiny nerves that go to the facet joint. We're nowhere near the spinal nerves or the spinal cord, so it's safe. There is some discomfort in the muscles, anywhere from a few days to a few weeks. And I generally recommend people, after having a denervation, take off work the following day because there is some soreness. But resuming normal activities and work after that is perfectly appropriate. After a injection procedure, once the 4 hours is up and one has kept the pain diary, again, there's no need to limit activity. One can be back at work the following day. Typically, the success rate in patients that have back pain, they're going to have facet blocks, is around 6 out of 10. In other words, 6 out of 10 people are going to see some positive response from that facet block, and 4 out of 10 are not. Of the 4 out of 10 patients that don't see success with the first injection, we typically don't do further injections there. I hope this has been helpful in explaining to you about lumbar facet-based pain and about the treatment options we have for facet-based pain. One needs to remember that that's not the only treatment that we look at. We try to look at the entire patient, so it's not unusual for us to also recommend continued aerobic exercise and core strengthening exercise. Anti-inflammatories may also be helpful. Physical therapy and chiropractic treatment may also be helpful, especially for flare-ups. Of course, we will go over this procedure in the office in detail, and I will answer any questions that you have regarding this procedure, and I will go over the specific risks and benefits that might exist for your particular condition and your particular medical issues. I hope this gives you a general overview of the process, and we look forward to taking care of you at Watauga Orthopedics. Thank you.